My name is David Lepofsky. I'm a visiting professor at the Osgoode Hall Law School, and I'm also the chair of the Accessibility for Ontarians with Disabilities Act Alliance. How have people with disabilities fared during the COVID pandemic? Imagine working in a high-rise office tower before the pandemic. Imagine that, as would be routine, the office has a fire plan in case there were a fire in the building. And the plan, as they often do, provides that should there be a fire, this will be announced over the public address system. And people will be directed if they should leave the building. If they need to, lights will illuminate on the floor to guide you to the nearest proper fire exit. And then once you get there, you're expected to go down the stairs to leave the building. That's pretty standard. Now imagine the fire alarm sounds one day because there really is a fire. And all of a sudden, the employer realizes, I got a problem. Some of my employees are deaf or very hard of hearing. They won't hear the announcements, and we haven't provided an alternative way to notify them of the fire alarm. Not only that, we have some employees who are blind or low vision. They may not see or won't see the lights illuminating along the floor to indicate which staircase they're supposed to go to leave the building. And when we get to the top of the stairs, the employer might suddenly think, oh my God, we have some employees who use walkers or wheelchairs. They can't go down the stairs. How am I going to get them out of this building? That kind of fire plan is wrong because it assumes that everybody has no disability. It's a one-size-fits-all emergency plan. You need to ensure that any emergency plan is designed to take into account the urgent needs of people with disabilities. That is the fatal flaw in how the Ontario government has approached the COVID pandemic. It has largely or too often pursued a one-size-fits-all emergency plan for dealing with this pandemic, and the result is that people with disabilities have suffered the consequences. I'd like to give you a more in-depth explanation of this conclusion, and I'm basing it on extensive activity that I've been involved in with others in doing advocacy to ensure that the urgent needs of people with disabilities are effectively addressed during the COVID pandemic here in Ontario. I'm recording this video on November the 3rd, 2020, almost 8 months into the pandemic, so I'm capturing our experience up to now. I'm basing it on my work in my leadership role with the Accessibility for Ontarians with Disabilities Act Alliance. We've been very active advocating on this issue. I've also served as a member of the Kindergarten to Grade 12 Standards Development Committee appointed by the provincial government, and we have a subcommittee on which I served, which developed detailed recommendations on what should be done for students with disabilities during the pandemic. I've also contributed on the Special Education Advisory Committee of the Toronto District School Board, dealing with education barriers during the pandemic at the municipal level here in Toronto at Canada's largest school board. And finally, I've been involved with other disability advocates addressing an issue I'll deal with later in this lecture regarding protection for patients with disabilities in our hospitals in the event that the pandemic overfloods hospitals requiring medical triage when it comes to critical care services. Throughout all of these activities, I've been extensively involved in trying to secure media coverage for these issues. More about that later. If you'd like to learn more about what the contents of this lecture, let me point you to some resources. Go to the AODA Alliance's website, www.aodaalliance.org. We have a COVID webpage with all of our advocacy efforts since March of 2020. That's at aodaalliance.org/COVID. You can follow us on Twitter because we tweet extensively about these issues at AODA Alliance. And you can also sign up to get our email updates where we've been offering a lot of the breaking news on these issues. Go to aodaalliance.org and go to the sign up link. Well, what overall has been the impact of COVID on people with disabilities? From early on, we were very much in the lead in pointing out that people with disabilities at 3 levels are being affected by the virus. First, people with disabilities are disproportionately exposed to simply contracting COVID. Many people with disabilities are seniors, and seniors were among the most vulnerable. But as well, there are many people with disabilities who have compromised immune systems, and as a result, they're more exposed. Second, people with disabilities who do contract the virus are disproportionately exposed or at risk of suffering its most severe consequences. If you look at the numbers early on in the pandemic, disproportionately people with disabilities were among those who were dying from the virus, particularly or especially those in long-term care facilities. And third, people with disabilities were made even more exposed to the virus by virtue of the government's failure, protracted failure to effectively plan for it. As but one example, the Center for Independent Living in Toronto pointed out early on in the pandemic that people with disabilities who live at home but need home care workers to come in to assist them, or personal workers to come in to assist them in such basic needs as getting out of bed and getting dressed and using the washroom first thing in the morning, important supports to enable independent living. Early on, we found out that those workers were not getting government-provided personal protective equipment, masks and gloves and so on, PPE as it's called. And they were required to go try to source it themselves during the early stages of the pandemic when there was a shortage and it was hard to find. Well, these folks who do this kind of work go from one client to another in the same day. So if they don't have the PPE to wear, there's the risk that they could either bring it into the home and give it to the individual with a disability, or the individual with a disability could give it to them, and then they proceed to the next home, work with the next individual with a disability, and pass it on and so on. So measures like this, failures to effectively plan, created added risks for people with disabilities to be exposed to contracting the virus beyond the biomedical facts. Well, in the face of this, what should government have done? Well, drawing on that fire emergency plan example that I started with, what the government needed to do from the outset was to include in its emergency planning for COVID, unfolding as the virus was hitting us, it should have included detailed plans specific to the needs of people with disabilities to ensure that their urgent needs during the pandemic were effectively met. And we and many others called on the government to do this starting right at the outset. Sadly, the government largely did not listen, and the consequences are among those that I will be describing. Back on April 7th, 2020, within the first few weeks of the pandemic, the Ontario Autism Coalition united with the AODA Alliance to hold a virtual town hall to explore the kinds of issues or impacts that COVID was having on people with disabilities in the important areas where we needed the government to plan. This got thousands of views. Unfortunately, what was presented turned out to time and again to be the case. Our pandemic identified such things as the failure of the healthcare system to effectively accommodate patients with disabilities during COVID, the challenges and difficulties that students with disabilities would face in education during the pandemic, the challenges facing low-income people during the pandemic, including those who are homeless. It addressed as well a spectrum of other challenges. Unfortunately, many of the recommendations that we offered in that virtual town hall were not acted upon. I'm going to spend my time with you focusing on two of these areas. First, education, and second, healthcare. So, education. Before the pandemic hit, we had an education system, both a kindergarten to grade 12 system and a post-secondary system, which sadly is replete with barriers that impede students with disabilities. We have been involved in advocating for years to get the government to develop and enact an education accessibility standard to tear down those barriers under the Accessibility for Ontarians with Disabilities Act. That work, much delayed, has been in progress when the pandemic hit. When the pandemic hit, it was necessary on very short notice for schools and colleges and universities to be closed and to move to distance learning or online learning. Of course, everybody was caught by surprise, and you got to cut the government and the education system a lot of slack as they rush to try to cope with this. We understand that. But after the initial dust settled, there was a pressing need for the government to ensure that it planned for the recurring accessibility barriers that students with disabilities would face during the move to distance learning. Let me focus specifically on the K-12 education context. What kind of barriers would students with disabilities face? Well, you can find out a lot about these by watching a second virtual town hall that the Ontario Autism Coalition and the AODA Alliance held, this one on the 4th of May, just about 6 weeks into the pandemic. There we focused on practical frontline strategies for teaching students with disabilities during distance learning. In that case, we identified a series of barriers that people with disabilities could face. Here are just some. First, it is necessary, if you're going to have virtual classes, to use a virtual platform that is itself accessible to the technology that we, people with disabilities, use. We've all learned a lot about platforms like Zoom during this pandemic. One of the things that we've learned is that some of those platforms are more accessible and some are less and some are terrible. However, there was no concerted provincial strategy to make sure that school boards across the province in Ontario, that's 72 school boards, all used only accessible platforms. At the time of recording of this, Zoom is by far the most accessible platform and easiest to use. And also, frankly, most popular out there in the world generally. Now, what happened was there was no concerted effort to make sure that school boards either used the most accessible platform or at least looked into this and knew what they were doing. And so the province, as it did time and again, left it to each school board to just reinvent the wheel or not invent any wheel at all. The result? At least one school board banned the use of Zoom, actually banned the use of the most accessible platform right in the middle of a pandemic. That can only work to hurt students with disabilities, teachers with disabilities, and parents with disabilities. Here's another example of a barrier that was experienced. The government of Ontario announced that it was partnering with TV Ontario, that's the provincially owned and operated public education TV network in this province. They said they were partnering with them to deliver online courses. Well, we audited some of that online content, and it only took a couple of minutes to reveal that it was sorely lacking in accessibility. There were significant accessibility problems. This is a government TV network that was not living up to basic accessibility requirements. When I say accessibility requirements, I mean websites that someone like me can interact with if you're blind and you're using a computer that uses a screen reading device, people who can't use a mouse and use a keyboard instead. There are a spectrum of well-known accessibility design requirements to ensure that a website or an online application is accessible. TV Ontario was way behind in this. We ended up making this public at our town hall on May 4th. Garnering some media attention on the issue. I ended up talking to the Vice President of Digital Content for TV Ontario and found out that, frankly, they were oblivious to this problem at the time. At the time, and this is in May or in April, They agreed that they needed to come up with a plan to address this, but we haven't heard a word from them since about any plan that they may have developed, or that's if they developed anything at all. A next example of a problem during online learning is online learning presupposes that a student with a disability can interact with curriculum content without assistance. Well, there's some students with disabilities who need to have an educational assistant with them at school to be able to manage and work with the curriculum that they're learning. Well, once we get to distance learning, that's gone unless we figure a way to deliver those supports at home. There are many other barriers that were experienced during distance learning. The provincial government's solution to the problem, sadly, was not to come up with common solutions to these recurring barriers and to share those solutions across school boards. Instead, what the province did was, yet again, come up with a one-size-fits-all plan like that emergency fire plan I gave you at the start, that didn't take into account any needs of students with disabilities, and then tell school boards, but don't forget, you should address the needs of students with disabilities. That means 72 school boards have to each figure out what the problems are, each figure out what the solutions are, try them out, and see if they work. Reinventing the wheel one board after the next, or failing at it, or simply not doing it, with no proper provincial oversight. This is a formula for higher costs, for less effectiveness, and for substantially disregarding or failing to meet the needs of students with disabilities. And all that in the middle of a pandemic. When we put together our virtual town hall, what we learned, that's to say the one about distance learning, the one on May 4th, what we learned just in a couple of days of volunteer effort was that there were people on the front lines who were of teaching who were coming up with clever solutions. But nobody at the provincial level was harvesting those ideas, reaching out to them, finding out what they were, and sharing them around to make sure that everybody could benefit from them. This is a serious problem. And to make all of this worse, despite the best efforts of school boards to try to struggle with this one at a time, uh, the province did not reach out to the front lines and find out what was actually going on and what was whether it was succeeding, what were the problems. So the problem persisted without the province making sure that it knew what was even going on where it matters the most, and that's in terms of individual student learning. Well, the result of all this, from the anecdotal feedback we got, was a total spectrum of experiences, wildly varying from student to student, from family to family. Some were inventing great supports and were making some real progress. Others not so much, and others not at all. It varied not by disability, but by the idiosyncrasies of who your teacher and special education supports happen to be, and what happened to work out in your particular in your particular case. So that's the situation for education through the spring. You could understand it being difficult to get this all started in March or April, but as distance learning continued into May and June, the government had ample opportunity to fix it and didn't. Not only that, but the government knew that distance learning was expected to continue in some form or other in the fall, whether or not schools reopen, and yet we saw no effort to effectively correct these problems, despite the fact that they were repeatedly brought to the government's attention. Well, all of that is bad enough, but that's only the first phase of the story. There's a second phase, and the second phase relates to the move towards reopening schools in the fall. Now, the government knew in the spring that at some point schools would reopen in the fall, and just as in the example I gave at the start, the fire emergency, it was necessary to have a plan built into the school reopening plan to effectively meet the needs of students with disabilities. The government was told this by community groups like ours back in June. We delivered a detailed brief. We were one of many that delivered detailed briefs to the government on what it needed to do during school reopening to ensure that the needs of people with disabilities were met. But not only that, as I mentioned when I list my background on this, a government-appointed committee gave the government detailed recommendations on July 24th, a detailed plan of what to do to ensure that school reopening met the needs of students with disabilities. And I sat on that committee, and it was a joint committee of disability community representatives and school board and educator representatives. So we brought together all of our expertise together. We were a subcommittee of the K-12 Education Standards Development Committee under the Accessibility for Ontarians with Disabilities Act. Well, sadly, the government hasn't really implemented that plan at all. Lead among our recommendations was the fact the government needed to implement a detailed plan for ensuring that school reopenings were done in an accessible way that students with disabilities could fully and safely take part in. We said that the government needed to establish a command table, a students with disabilities command table that's staffed by experts in education of students with disabilities. It's not a table of students with disabilities. The government during the pandemic had a healthcare command table and a economic command table and several command tables of experts that it turned to make its detailed plans. Well, we said that the government needed a students with disabilities command table to plan for the effective school reopening and to be able to do rapid response when problems are recurring in different school boards, because we knew unexpected things might come up. Well, the government didn't do any of that. And we thought it was especially important for that command table to have expertise in managing or in educating students with disabilities, not simply experience as government managers. Well, that wasn't done. The other thing we did is we said there were a number of things that needed to be taken into account. Obviously, addressing the digital barriers in distance learning remained really important, but it was also important to build into the plan opportunities for the kind of barriers we foresaw that students with disabilities could meet. What might they be? Well, some of them could be built environment barriers. We heard a report from a family of a student with vision loss that the school set up a dispenser for hand sanitizer, but in an inaccessible location that the student couldn't find. For students with low vision, the problem is that if they mark areas of where to stand on the floor to be able to socially distance, that would be a problem for students with low vision if they don't use proper color contrast. These aren't expensive things to do. You just got to do them right. And you can't expect every principal to know how to do this. That's why you need provincial standards that save each school board the burden of trying to figure out what they need to do. As well, the barriers that we anticipated or difficulties we anticipated was that some students with disabilities might not be able to socially distance on their own, either because of behavioral issues or otherwise, and they would therefore need some additional staff support, whether educational assistance, special needs assistance, or whatever, to ensure that they're able to socially distance safely. Well, again, we didn't see any comprehensive provincial planning. In fact, all we saw was a government announcement, I kid you not, that they were going to spend, at first they said $10 million of added funds for students with special education needs. Later, with federal money, they raised that up to, I think, 22 million. We did the math. That averaged down to about $67 per student, not per day, not per week, I mean period, which is paltry and certainly inadequate to meet the kind of needs that they were talking about. The bottom line is that each school board is left floundering and trying to figure out what on earth to do. And as well, from anecdotal reports, some students are coping okay, and others are students with disabilities are having serious difficulties. But there's one other thing that we identified during the summer, which was a serious problem, and which the government needed to address but didn't. Let me take a moment to drill you into a detail in the education system that a lot don't know about, but it's actually really important for students with disabilities. In the Education Act, every school principal has the power to refuse to admit a student to school or any person to school if, in the opinion of the principal, that person's presence in school would be detrimental to the well-being of the students at school. Now, this is section 265 sub 1 sub M of Ontario's Education Act. It's been around for a certain amount of time, and it's been controversial in the disability community well before COVID, because disproportionately it's been used to exclude some students with disabilities from school. Now, we're not talking about a suspension or an expulsion under student discipline. This doesn't have any of those safeguards built in. And indeed, under the Education Act before COVID, it's been a problem because there's no time limits. A principal could refuse to admit a student to school for days, weeks, or months. They aren't required to give any reason or any due process. There's a right of appeal to the school board, but beyond that, nothing. And I could tell you that the AODA Alliance and the Ontario Autism Coalition, the Arch Disability Law Center, and others have been raising serious concerns about the power to refuse to admit or exclude students well before COVID. Why has this become a COVID issue? Well, during the pandemic, we were deeply concerned that during this reopening of schools, some principals might use this power to exclude some students with disabilities from school, not just as they did before, but even worse, because they didn't know how to effectively address their needs in school during the reopening during the pandemic. And at one level, you might be able to understand that from a principal's point of view. If they don't get proper guidance and proper support from the province, if their school board is floundering on what to do, then the school board, the principal might figure, I don't know how to handle this child's needs, so I'm just going to call mom and dad and say, keep them at home. They can do distance learning. And we warned the province of this concern in July, and making it an even stronger case. The AODA Alliance released a report in the middle of July where we had surveyed all 72 school boards to ask them, what is your policy on refusals to admit or exclusions? What are your directions to principals on this subject? And what we found out was that when we surveyed them, half of the school boards didn't even answer us. And of the 72 school boards, less than half even have a policy on the subject, and those policies vary widely from a lot of detail and some good components to little or no detail or troubling components. So we've called on the province to adopt clear directions to school boards on what is permissible and what is not permissible in the use of the exclusion power, to set provincial standards in this area. Again, the province has not done so. Well, let's turn our attention now from education and the barriers facing students with disabilities to healthcare and the barriers facing patients with disabilities. Now, before COVID came along, our healthcare system, to the surprise of many, was replete with barriers that impeded accessibility for patients with a wide spectrum of different kinds of disabilities, whether physical disabilities, sensory, mental health, learning, intellectual, communication, or other kinds of disabilities. This had been a problem for years. The AODA Alliance campaigned for at least a decade to try to get the government to do something comprehensive about this, namely to enact a comprehensive healthcare accessibility standard under the AODA to tear down those barriers. Well, a few years ago, we finally got the government to agree, and belatedly, the development of that healthcare accessibility standard was underway, but not finished, when the COVID pandemic hit. Well, as in the case of education, the COVID pandemic led to an exacerbation of the different barriers and the kinds of barriers that people with disabilities face in the healthcare system, because the healthcare system, like the education system, is designed and operated largely on the basis that it's there to serve people without disabilities, even though the people who use the healthcare system disproportionately are people with permanent or permanent disabilities. I gave a lecture before the pandemic began about the barriers in the healthcare system that will be linked to this video in case you want to get a broader sense of what those pre-COVID barriers were. However, what did we find? Well, at our first town hall during COVID, we outlined for the public and the government some of the barriers we anticipated that could hit during the healthcare system, and sadly they did. First in line was a deep concern that COVID would have a disproportionate impact on patients in long-term care facilities which were not equipped and ready to ensure that their needs were met. That's in fact what happened, and as I mentioned earlier, there were a significant number of deaths of people in long-term care. Those are, by definition, people with disabilities. As well, at our town hall, a leading expert on communication disabilities in Canada, Barbara Collier, explained a concern that patients with communication disabilities would face barriers in receiving health care in hospital during the pandemic. We're not just talking about people with hearing loss who need a sign language interpreter. These are people with other kinds of communication disabilities who need either technology or a human intervener to use alternative and augmentative communication techniques to enable them to communicate. Effective communication is pivotal to being able to seek and receive medical services. And the problem during the pandemic was that hospitals are typically not equipped to provide these communication supports. It's usually up to the patient, unfairly, to have to bring them with them, either a family member or a professional. But during the pandemic, when the pandemic began, hospitals, in order to prevent the spread of the disease, precluded visitors from coming in to the hospital, including those needed to provide necessary essential services for patients. Similarly, a Toronto Sun report in the early weeks of the pandemic highlighted another absolutely inexcusable barrier. One hospital in the Toronto area reportedly required a patient who needed a tablet, an iPad, or other such device to effectively communicate, required them to give up that tablet 23 hours a day and only be able to use it 1 hour a day. This individual had a condition similar to Lou Gehrig's disease, where they couldn't communicate except with the use of that device. Why did the hospital take it away? According to the report, it's because the staff were concerned that it might be used for surveillance of staff, I guess to video record them. Now, anyone who's ever walked into a hospital with a smartphone is carrying the same kind of technology with them that could be used to surveil staff, and they don't make us turn over our smartphones either to visit or be resident, or probably be patients in hospitals. So it would be inexcusable for this to happen in the middle of the pandemic. Now, what makes things worse is, according to that same report, that the Ministry of Health declined to intervene at all to try to address this situation, saying it's leaving it to the hospital. Another barrier that we anticipated was this. It was expected at the start of the pandemic that the surge in infections could lead to a need to create temporary facilities for overflow patients. It is necessary to ensure that those facilities are designed to be accessible. If you're going to find another building to use, pick one that's accessible, and so on. We offered advice in this. Regrettably, no one followed up with us to try to build or draw upon that advice. The worst illustration of the many barriers that patients with disabilities have had to experience during the pandemic, or the ugliest manifestation of it, took the form of the clinical care triage protocol that the government of Ontario sent to all hospitals in late winter or early spring of this year. Now, I'm giving, or will be giving, a separate lecture that will be available online detailing in far more extensive detail this issue, but let me just briefly summarize it here. It was understandably expected in February or early March of 2020, as this pandemic was arising, that there was a possibility that the spread of the disease could lead to a flood of patients in hospitals that was greater than the hospitals could accommodate, particularly in critical care services. Now, initially it was talked about in terms of ventilators, would there be enough to go around? But later this expanded to concern about whether there were enough beds, not just physically a mattress, but places to receive care, critical care, and doctors and other staff that were available to support the number of patients. This has happened in other parts of the world early on, particularly Italy, when the pandemic hit. Now, as of the time of recording this, it has not happened in here, and we hope it never will. But the government properly contemplated that there was a need to be ready for it. So the government appointed a bioethics table, an advisory table of doctors and bioethicists to come up with a proposal. Unfortunately, this was all done in secret. Nobody talked to the public about it. They may have consulted in the health sector. They didn't consult any of us from the disability community. A protocol was written, dated March 28th, and the government received it and sent it out to all hospitals. Well, this protocol is deeply troubling and problematic. And it leaked eventually to some within the disability community. This led a number of folks to organize to raise serious objections to it. When this came to the attention of my coalition, we joined in this effort and became a partner in the effort. Put simply, the concerns were these. It was a serious concern at the outset that this protocol would discriminate or allow for discrimination against patients because of a disability. That is to say, in a decision of who gets, if there are more patients needing critical care than spots in the hospital or equipment to provide that critical care, that a person's disability might be held against them. That was the primary concern. As events unfolded, that I'll describe in a minute, these concerns expanded to other concerns as well. This concern was taken to the public. The government claimed that this protocol was only a draft, even though it wasn't marked draft, and eventually said that they would consult on what should be the rules. Over the summer of 2020, the Bioethics Table consulted a number of organizations, including the AODA Alliance. I took part in those consultations. And we learned more and became more concerned about what was being proposed. We had an opportunity to comment on a revised version of that protocol, one which we, with permission, made public. And we eventually gave a concluding presentation to the Bioethics Table on the 31st of August, as did the Arch Disability Law Center and others who were working together with us as a collective effort from a disability perspective. Linked to this video will be a video of my August 31st closing summary of our concern, and online available at aodaalliance.org/COVID is the written presentation that we made, as well as the written presentation that was made by the Arch Disability Law Center, an excellent document that we entirely endorsed. As of the time I'm recording this, the Bioethics Table has sent its recommendations to the government and to the Ontario Human Rights Commission, but they haven't been made public. We've called on the government to make them public, and we've learned that the Ontario Human Rights Commission and the Bioethics Table have called on the government to make them public as well, but so far the government has refused to do so. We've also called on the government to retract or rescind the March 28th initial protocol that they sent to all hospitals. Other disability groups, the Human Rights Commission, and apparently the Bioethics Table have also called on the government to do so. As of the time of recording, the government has not agreed to do so. It has not told us it will do so. It has not made public the advice it's received from the Bioethics Table. And it's not agreed to any public consultation, something that's much needed, long overdue, and especially important given that at the time that I'm recording this, a second surge of COVID infections is growing, making the risk that such a triage protocol would be needed greater and greater every day. So I said that our concerns about the triage protocol expanded, and the lecture I'll be giving soon that will be available online about the triage protocol will go into much more detail about those concerns. But beyond our concern, our fundamental concern that the proposed or the existing protocol is discriminatory against patients with disabilities, that's enough to be fatal to this document. We had other concerns as well. We're not convinced, I'm certainly not convinced, that such a life and death decision as to who gets an insured healthcare benefit that they need to save their life, that such a decision could be made based on a memo from some government bureaucrat to hospitals, a memo written by an advisory panel of bioethicists and doctors, and something which for which we've not seen any legislative mandate or authority. We're concerned about basic rule of law concerns here. In addition, we're very concerned that the supposed rationale for this protocol, the criteria that it sets out for deciding who gets this life-saving care and who will not if there's an overflow of demand or an excess of demand that exceeds supply, that the criteria to be used are not only discriminatory, but they're not proven to be scientifically supported by data. The research that the bioethics table shared with us did not show that those criteria are justified as a measure of who's likely to survive and who's likely not to survive for the entire spectrum of ages from 18 up that the protocol would cover. As well, we are deeply concerned that the protocol does not provide for patients whose life is at stake the kind of due process protection to which they should be entitled. Right to fairness, right to input into the decision that would affect their very life, right to appeal it if the decision is against them, and right to rights advice in relation to this. We spell this all out in much greater detail in our August 30th written submissions that were submitted to the bioethics table. You know, I'm recording this in November 2020. 40 years ago this fall, the Parliament of Canada was considering whether to patriate Canada's constitution. And while it was considering that, it was debating whether to include a Charter of Rights. The proposed Charter of Rights then before Parliament commendably included an equality rights clause, section 15. But as originally drafted, that clause did not include a guarantee of equality for people with disabilities. I and others from the disability community organized and advocated to get that provision amended, and we succeeded. We got a disability amendment to the Charter of Rights before it was passed. It's the only right that was actually added to the Charter of Rights during the patriation debate. Why am I mentioning this? I must tell you, as I reflect back on those days and ever since, while what we won was important, I never contemplated that it would be necessary to invoke it in response to a government protocol during a pandemic that could actually discriminate against patients in access to life-saving medical care because of their disability. Wait. Don't turn off the video. The lecture's not over. You thought it was over. In fact, when I was finishing it up, I thought it was over. But today is November 5th, 2020. And earlier today, the Ontario New Democratic Party in the opposition, the Ontario legislature, put questions to the government during question period about the critical care triage protocol. They asked them to rescind it, the March 28th one that throughout this lecture I said wasn't rescinded, and the government said, well, we rescinded it. We haven't seen any proof of that. We're going to have to take new action on that. They were asked to make public the bioethics table's recommendations. They didn't agree to do that. They didn't say anything about that. More about this in my PS that I have to record for my new lecture on the history of the triage protocol. What does this show? When you're doing advocacy on these kinds of issues, things can change by the hour, by the minute. This is up to date as of now. Who knows what's going to happen 5 minutes after I finish recording? Stay safe.